new mamas and mamas-to-be, I want to talk to you about your C-sections, whether you're planning to have it, aware that it is a possibility, or recovering from it. I want to help you recover faster, stronger. Here are a few Cole's notes, really important key tips that I'm going to elaborate on later. Number one, as quickly as possible, as long as you're not in debilitating pain, I want you to stand up straight. Yes, there is a scar, and yes, it's going to feel like a stretch, but the scar and that wound will be stable such that you can stand up tall. Being hunched over will feel like initial protection, but it won't help you. I'll elaborate on how you can go about doing that later on. Number two, do not hold your breath. Holding your breath will increase your intra-abdominal pressure when you're moving in bed, when you're getting out of bed, and cause more pain and pressure on that incision. Number three, if there's sensitivity, you can either get a prescribed or over-the-counter lidocaine that you can put directly on that incision and do some gentle scar massage later on with just a natural oil or lubricant to just feel that fascia underneath once the wound is healed. So initially, to decrease sensitivity, you can get a little ointment with some lidocaine that just takes off the edge, and then later on you can start to desensitize by touching the area softly and then gradually a little bit more. Number three, really important tip for someone recovering from C-section is going to be how you move. So when you move in and out of bed, it's so important that you do not hoist yourself. And this goes for anyone with abdominal surgery, not just C-section. You're not hoisting yourself up to get out of bed or pushing up. You do not want to see pressure pushing out on the abdomen. So then how do you go about getting in and out of bed, or even getting up from a really comfy couch? The key here is, if you can, first of all, you want to draw your belly button in. And if that doesn't seem like it's very accessible to you right now, that's totally fine. Instead, you'll just take a deep breath out. So breathing out naturally snugs those muscles in the inner core and will give you a little bit of a bracing mechanism. As you move, you breathe out and you move onto your side first if you're in bed. Take a deep breath there, make sure you're still breathing, and then you'll push up with your arms as you bring your legs off the bed like a lever. So if you think about a counter lever, legs coming off the bed will bring the weight of the body upright as you're pushing. This takes some practice. So the number four thing that I want to say that's a really important tip, easier if you're in British Columbia, but doable hopefully anywhere else, is make sure that you get someone to help you one-to-one to use these strategies. So if you are in British Columbia, if you are delivering at BC Women's Hospital, not everybody knows this, and there's another video on my channel that talks about this in like best kept secret mode, even though it's not a secret. Everyone should access BC Women's physiotherapists that are there. So they are there. If you deliver and you simply ask your nurse to see a physiotherapist, then they will come, they will help you, and sometimes it's a godsend, honestly, and you get the support, the reassurance, the education that you need. Amazing service. Everybody should have it, every country should have it, France has it, and so do we in BC, but because there is only a couple of physios working there, it's not as well known. Really experienced physios. I could go on and on. I do cover there once in a while, so full disclosure, very infrequently I cover just because I'm attached. I primarily work at my clinic here. So it's the chances of you seeing me there are very rare, but the other ladies there are incredibly experienced and helpful. So please see them and get the help. It's public service, so no private pay fee, and it is wonderful. You can also see them before or after pregnancy within 6 weeks. So that tip is to get help. If you can, public service help is awesome. And if not, have a consult with a physiotherapist if you're just having too much pain. Now, number 5, your surgeon, your OB/GYN may or may not say you do not do any abdominal exercise after surgery. So again, I'm going to put this into the umbrella of abdominal surgeries. Now, it's important to distinguish what that means, and they may or may not go into this level of detail. So when they say do not do abdominal exercise or do not use your abdominal muscles, They are talking about that concentric action of moving into that flexion mode, using your six-pack muscles. They're talking about avoiding pressure out, avoiding bigger contractions. What they aren't necessarily having time to educate you on is that your abdominal muscles, your core, is working all the time. So how can you boost the natural activation that's already happening? You can understand that there is a bit of an inhibition going on. So whether you had a hysterectomy, whether you had a C-section, or whether you just have some other kind of abdominal surgery, there is going to be a level of trauma because you have to open up the muscles in order to take out baby, in order to do things. And as a result, there's going to be inhibition of those muscles. So what you can do from day one, as long as it doesn't feel too painful to you, is draw your belly button in and try to take a breath as you feel that contraction. Now, if you try to do this at home, or you do this in the hospital and you find actually you're pushing instead of drawing, then that means you probably need some help. So don't go any further at that time, because you don't want to be doing anything that's actually causing more stress on the incision. However, for most people, they're able to just draw the belly button in. I find sometimes if you can't find it right away, use your breath. So take a deep breath in, breathe out, and the belly button will naturally draw in. And then you can start to hold that, breathe through that, and then your physiotherapy can do a stepwise approach on how to reactivate those deeper core muscles, your transversus abdominis, and that will absolutely help you. So number 6, you can offload with your upper body. I said I would elaborate later. I feel like I'm elaborating as we go, maybe just the first point later. You can offload with your arms initially. So if you are in the hospital or you're at home and you have something and you're getting tired and it's just, there's a lot of discomfort here, you can either use a walker that's going to offload this abdominal area initially and help you walk normal faster and help you be upright faster. Again, it's really important to be upright to try to have some natural breath as fast as you can. So I guess we're on number 7. Are we on number 7? So the next thing I want to talk about is understand that your pelvic floor may still be affected. So you may have pushed or not pushed, whether it's a scheduled C-section or not, but the pelvic floor is deeply connected to that inner core, and it also has been affected through stretching, through pressure throughout your pregnancy. So a lot of people who have come to me at BC Women's postnatally and said, you know what, I'm having a little bit of leaking, and they may be or may not be extra concerned about it because, well, I had a C-section, so what's wrong? This is not natural. It is natural. It doesn't mean it's normal, and if it does continue after 4 weeks, you absolutely do not want to take that as your new acceptable baseline. You want to get help. Again, see BC Physio, BC pelvic floor physio, and they will help you. I should say that at BC Women's, you will not have an internal exam, and those internal exams should happen 6 to 8 weeks or after. There's no rush. And so that time that the BC Women's Physio would see you would coincide with that initial postnatal, just figuring out your body again. Number 8, do not wear a baby carrier directly on that area. Really important. You need that wound to heal, and you also may or may not be comfortable with that pressure there. Number 9, do not necessarily go straight to wearing an abdominal binder. First things first, you want to make sure that that wound is healing well and that the edges are not kind of like squeezing together, so that there's like a nice comfortable flatness to that. If you find that wearing an abdominal binder, so it's something that kind of stretches around and snugs you in, makes a difference between you being able to walk and function in your house versus not, and that is a great use case. But if you find that you're using it because you feel like you like the appearance more, or you find that you're not actually finding those muscles because you're using the abdominal binder, then it's not helping you as much. So use it according to what is going to get you further long term. And let me see if I have any other points that I want to make. There are so many. It is not a one-size-fits-all physiotherapy consult, assessment, and treatment. But there are these common things that I find that coming into that inpatient room, that mama is sometimes a little bit, I'm going to say a little bit depressed because maybe that wasn't the kind of birth they wanted to have. Not always. So sometimes we have to sort of frame it as, you know what, this is such a successful birth, baby's healthy, you're healthy, you weren't counting on this, we know this, but it is important that we find out how we can help you. And one of those things that might not be natural to you right away is just finding your breath. So we talked about breath holding. Also things like, I guess this would be the 9th or the 10th point, breastfeeding baby. If you're breastfeeding or bottle feeding, whichever you choose to do, try not to put pressure on that uterus those first few days while it's still shrinking, because that pressure on the uterus is pressure on the abdominal wall, and possibly pressure in the incisional area. The last point that I will make is that it is important to get some flat rest. So you might not be comfortable on your side flat, so maybe it's on your back initially, but offloading fully the pelvic floor and the abdominal wall does not happen very well if you're sitting up. So it is important to sometimes, when you have a chance to rest, unless you've had triplets, in which case you probably have very little time at all, that you are flat, that you have full support, maybe you have pillows under your legs, make sure you're completely comfortable. I hope this has been helpful. My name is Mary Stern. I'm a physiotherapist. I work in North Vancouver, British Columbia, which is why I've been talking about BC Women's Hospital Public Service. And I have my own clinic here in North Vancouver called Blue Ridge Physio. I see all kinds of orthopedic patients. I have a soft spot for new moms as well, so I will treat their orthopedic conditions as well, and I do clinical Pilates. I use a combination of yoga, dry needling, as well as manual therapy. Please, if you found this information useful, I would love a chance to connect again, so please do subscribe, and I hope to be in touch with you. Thank you.